666.
We are speaking today with Dr. Mohammed Alhajji, Director of the Behavioral Insights and Nudge Unit at the Ministry of Health, Saudi Arabia. Dr. Mohammed, thank you so much for joining us today.
Yeah, absolutely. Thanks for having me.
Mohammed, I'm really fascinated by what you do. But before we get there, I want to give a shout out to Bill Connor. Bill Connor's with Oratorio Media. He's someone we've known a long time. He's a good friend. He's someone who's very familiar with Saudi Arabia. And he called me, and I shared this with you, Mohammed. I call it the Costco Conversation because I was in the middle of Costco, and he gave me a ring, and he said, "I love your new podcast. Let's talk." Because he had been working with the Ministry of Media in this skilled speakers program.
Mm-hmm.
And he said, I'm meeting the most fascinating young Saudis. And I know, Richard, that you're going to want to do this. So you, Mohammed, went through the skilled speaker program, right?
Correct. Yes.
So I'd like to touch on that. And then, of course, when he said, all right, these, you need to connect with Mohammed. And I saw what you're doing with the Nudge Unit. But we're not going to jump in there. I just thought it was brilliant that it was named the Nudge Unit.
Yes, indeed.
We were just talking beforehand, and you're in Riyadh.
Correct.
It's during Ramadan, so it's 11:15 at night there. Thank you very much for you were going to be up, but thank you very much for staying up and looking so good to meet with us. But you were talking about the Eid break, traveling back home to Dammam to see your family. And you had said in that conversation, you said part of the reason you want to see them as frequently as possible is because you spent 15 years in the States studying.
Correct.
Can you tell us a little bit about that journey?
Yeah, absolutely. Thanks for having me. I really appreciate this platform. So I was back in 2005. I was among the lucky ones who graduated from high school when King Abdullah, who back then wanted to reestablish the relationship between the US and the kingdom in light of the tragic events in 2001. So as part of the initiatives to empower Saudis to broaden their perspectives and just really generate the next generation who could lift this country up to the sky. So the scholarship program was announced right like a month before I graduated from high school.
Wow.
And me being from Al-Ahsa, it's called Al-Ahsa in East Coast. It's a rural town. I'm in a very small rural like village. We call it a village. It was really like almost unbelievable for me to leave this town, which I spent my whole time in. I hadn't traveled abroad before that much. So I spoke zero English. I came from public school, so no privilege whatsoever. So it was all sort of all these factors that you would think would prevent someone who is 17 and a half to go live in Indiana. So it was outrageous even to think about it. So thankfully, my dad was supported. I seized the opportunity. Thanks to the Ministry of Higher Education, but back then things were very smooth. I left Saudi Arabia in pursuit of my education, and little I know that I would be there from 2005 all the way to 2020, and unfortunately, I said goodbye to the States in a really interesting flight in light of COVID. So. It wasn't such a pleasant goodbye, but I still have all these feelings to the States and all these lessons that I learned through my bachelor's, my master's, my PhD. I worked there between my degrees. So it was such an enriching experience during my bachelor.
Mohammed, can I jump in here for a minute? And I'm sorry to intrude.
Yes.
But this, most Americans don't understand how expansive and extraordinary this scholarship program has been. And 2005, right at the beginning, I recall it came out of King Abdullah had gone to meet with President Bush on his place in Waco, Texas. And he came out of that, I believe, announcing this scholarship. And there wasn't really a full awareness of what it was going to be. But what it became was up to 90,000+ Saudi students at this most often with dependents. So,
Absolutely,
the actual population would go more. And that was, I just really want to emphasize, that was one of the extraordinary aspects of it, is that this young kid from Al-Asa that was going to public schools, had never been there. It was open to all who were qualified. And the Saudi Aramco experience in terms of U.S. Saudi was seminal. It was, it was something that bound the country together. This scholarship program has also bound the countries together in many ways because of students like you who went off at 17 and spent 15 years. But anyway, I just wanted to interject there because we are such big fans of that scholarship program.
Oh, absolutely. Really, as you mentioned, that this scholarship program, I think, is one of the largest youth development programs around the world throughout history. Really, I mean, as far as quantity and equality, because think about it, a kid coming from a rural town got the opportunity to study in Harvard, Princeton, Colorado State University, all these schools. It was equal opportunities for all. And this empowerment generated income and social class for many, many families who would never make it without this program. And if I recall correctly, if my assessment is correct, this is the first program that was a social mobility driver for all classes across the board, across the regions, across religious sectors. So this is really, like, whatever you say is not enough to applaud this program, and of course the creator of it and the visionary King Abdullah, and then King Salman, and now the Crown Prince in progressing and keeping this program alive with even better refinement, with the lessons learned through the years. So it's even better and better now.
Agreed. Just an extraordinary program. So I interrupted you. So you're 17 and a half, and you say goodbye to mom and dad, and they're going, we're going to miss you, son, terribly.
Yeah.
And you land at Colorado State University studying biomedical sciences. So take it from there. Why that? And why there?
Yeah, it was insane. I wish it was Colorado. It was even it's even remote than Colorado. It was Indiana. It was Valparaiso, Indiana, in the middle of nowhere, for real. Like, it was even like more dead than my village in Saudi. So you know what I mean? Like you have this kids who had seen the US just through Hollywood and movies, and he was thinking skyrockets and New York style US, and then all of a sudden you're in Valparaiso, Indiana, like with dead silence, and like people go to sleep 6 p.m. It was such a shock. You know what I mean? That's the real America, yeah. So back then, like I studied for a couple months in Indiana, and then I had a friend who went to Colorado State University. And during the first year, since we spoke zero English, we had to go through an English preparatory program. So I transferred to Fort Collins, Colorado, and that was one of the best decisions I made. It's such a beautiful town. I don't know if you've been there, but Colorado as a whole is such a beautiful state. So since I was an overachiever in high school, and I had a good GPA, and automatically that makes you a medical student. So out of ignorance and not knowing the higher education system in the US, with almost zero cumulative experience, because the program had just started 2 months ago. So nobody really had a clue how this worked. So I went there thinking I would study. I wanted to go to medical school. But when I arrived to the States, little did I know that there is no such a thing as medical school for fresh graduates from high school. You guys have a different system in doing bachelor's in kind of life sciences, and then you compete like crazy to get into med school. So I got trapped into medical sciences, like biomedical sciences, which is like really broad. Like, it's cool, but you don't master nothing. I mean, because you study physiology, endocrinology, anatomy, and all these just, cross the board life science, but when you graduate, you think like, what did I learn? Like, and then, yeah, it's very broad. And then going to med school was really and is still an impossible mission for international students. It's hard enough for in-state students, and it's harder for out-of-state students, and it's even almost impossible for international students because of all the tests and the competition and all this stuff. So I finished that, and then I was like, okay, now I study the human as tissues and cells and hormones, but I'm more intrigued into the human as a social being, the human as the mind and the soul of the human, not these tissues and the cells, and so that's when I made my I pivoted into public health, because public health studies health from a social perspective as opposed to a medical perspective. So I opened the map of the United States, thinking, okay, where am I going next for my master's degree? And speaking of how great the scholarship program was back then, when you graduate and finish a degree, as soon as you get an admission from the higher degree, you extend your scholarship. It was such a seamless process. You just get another admission and you continue your education. This is how generous it was, and it still is with some refinements. So I opened the map and I thought Florida was a nice change from Colorado. And I went to Tampa for my MPH at the University of South Florida. And I stop here for you guys if you have any questions.
Well, we have friends over the Saudi Arabian Cultural Mission, and they're not far from where Lucian and I are based around DC. And I think it's interesting because you're right. You know, early on in terms of administrating this, everyone was sort of on a very steep learning curve and how to manage things. And of course, when you have a huge population of citizens in the country, you have all sorts of non-education issues. You know, all the way from just, you know, getting visas and all the logistics of managing and helping and assisting. So it is fascinating that you were right out of the gate one of the early ones. But your reasoning from going from Colorado, Fort Collins to Tampa is wonderful. But I don't understand, how'd you end up in Philadelphia now? once you get your doctorate.
Yes. So Philly is an interesting choice, and I'm really glad that I made that choice. So again, speaking of how great this program is, it supports your dependents as well. So my wife at the time had finished her art therapy bachelor degree in Tampa University. So we wanted a city that has universities with PhD in behavioral sciences for me to complete my education, and also has a master's degree in art therapy for my wife.
Interesting.
Because why not? We both have the opportunity, so let's advance our education. And given how niche our majors are, we ended up with very, very few options that could accommodate both of our degrees. And Philly was one of them. She went to Drexel University, the first and oldest art therapy program in the world. And I went to Temple University because they do have a great social and behavioral sciences program for PhDs.
And it seems, so you earned your doctor of philosophy in social and behavioral sciences at Temple. And you spent a lot of time there. And it seems like that's where a lot of your, in reading your background and growth and what you're doing now, it seemed like a lot of that came together in Temple,
Absolutely.
You were teaching, you were researching. But before I get there, art therapy, that's fascinating. Is your wife able to practice that in her skills? What's her in Saudi?
Yeah. At the moment, she is actually seeing clients right now. There's some regulatory difficulties in kind of accrediting this field in Saudi because there's so few of them. I think there's like 7 of them in Saudi. So they don't have an accreditation and evaluation process as a health practitioner. And she is working through that. But such an interesting field. You never know that mental health care could take different forms. And now there's dance therapy, there's art therapy, there's play therapy, and these are the alternative ways
Right.
of dealing with mental counseling now.
And
So it's, yeah.
the whole field of mental health in Saudi Arabia is emerging because it's really been sort of a taboo subject. It's not something, it's a process that every country goes through, and it's still a bit of taboo. But I know in Saudi, there's been a great effort to destigmatize it.
Right. I mean, given how collective our community is, and the whole society really is really collective, and the stigma that is attached to mental illnesses kind of make you lose face and make you lose reputation just by nature of being diagnosed with one of these disorders. So people keep kind of brushing it under the carpet. So you are absolutely right. But there is now, with the revolution and the societal changes that we're going right now, mental health got a nice attention in destigmatizing the whole thing and making services available to all. And of course, the technology has helped with platforms and online therapies. So it's really good.
So I want to return to your interest in the human as a social being, and how this developed while at Temple, because the next step is going to be, it sounds like it's going to be a sort of out of left field. But first, let's talk about your time in Philadelphia, because a lot of what you were doing, you were supporting the development and implementation of federal and private grants on health decision making and health communication, which seems to be very consistent with what you're doing now.
Right. So I always say one of the best decisions in my life was to get my PhD, because I do believe that the real, like in PhD, you really dig deep in the philosophy of the science, as the degree hinted at the name. Okay. So the PhD experience, and I was super lucky to be at Temple with my advisor. A shout out to Dr. Sarah Bass. She was the greatest mentor I would ever ask for. Really, she was enabling. She was busy. She was productive. She kept us busy as researchers, which what a PhD should be. Right. We worked in a lab, in a decision-making and health communication lab, where basically we're designing messages and designing decision processing tools to help patients navigate the healthcare system, to navigate treatment options. For example, breast cancer patients, how do they navigate the options for treatment? It's not just making services available, but also how to sell these options to people and make them really pick the one is right for them. So shared decision making was a big topic that we tackled through grants from NIH, for example. So through this experience, I matured as a researcher in a heavy way. I mean, I graduated, I finished my PhD with, I think with like 10 publications between first, third, and second authors, which is, it's amazing. It's really amazing. And I'm not talking about just like nominal superficial work or just putting my name in it. No, really like real contribution, real work into the research, into the grants. So it was such an enriching experience in my life that set me up, as you said, as the researcher I am right now, as a leader in this field. Thank God for this opportunity. So it really made me fly in the science.
Well, all right. So here we are, 2015. No, 2020. 2020. It's time to go home.
Yeah.
So extraordinary 15 years. I mean, in that period, did you get married during that period?
Yeah. So it was really cool because I experienced the States in different phases in my life. Like I went when I was 17 and a half, like just a single person who had no idea what was coming to him in life. And so I immersed my life myself in the college life, meaning I was involved in different associations and clubs, the student assembly, the student government. So being single back then gave me the time and the cognitive resources to be busy in these activities. So I had my share in that aspect. And then right before I finished my college degree at Colorado State University, that's when I decided I wanted to get married, and I wanted my partner in life to be with me in the States and live the same experience, so we could really be harmonious together in life. So that's when I got married, and then she went to school thanks to the scholarship program, and then we just kept pushing and pushing, and we got our higher degrees like this.
That's beautiful. So,
Awesome.
so here you are coming back to Saudi Arabia.
Yeah.
Very proud, your parents. You've got Doctor of Philosophy from Temple in Social and Behavior Sciences. You've really worked hard at this field, and you come home and you start the Saudi Genome. Just complete. Isn't that a complete departure?
Yes. So Saudi Genome actually started in 2015, even before
you left.
Yeah, yes. I was working remotely with my partner because me being interested in health as medicine and as public health, I was really keen to kind of solve some of the health issues in my community. And me coming from Al-Ahsa in East Coast, Saudi Arabia, it's one of the hot spots for hereditary diseases and genetic diseases due to intra-family marriages. So you have a higher chance of acquiring or getting a genetic disease in my hometown as opposed to other towns in Saudi Arabia. So me personally is affected in my family, in my extended family, with genetic disorders, all sort of genetic disorders. So I partnered up with my relative, who was also a friend of mine, and we started this genome project to help reduce genetic diseases in our smaller circle, because we were just a smaller team.
Right.
And we were doing that by offering genetic tests so that couples, or even before getting engaged or anything, they could screen for genetic defects. And based on this powerful information, they could make an informed decision whether they could proceed with marriage or not. So all you need to know, genetically speaking, specifically if we're talking about what's called recessive genetic disorders, which require a defective gene from two parties to make a sick or a child with the illness.
Right.
So all you need is the genetic defect, whether it's present in both parties or just one. If it's one, then it's good. You're good. You're not going to have kids with diseases. But the problem is if both parties have the genetic disorder or the genetic defective gene. So the solution is really straightforward. You screen both parties, and you find their, thanks to technology, you could find the defective genes in both parties, and then you could provide the report to the prospective couples, and they could make their decisions whether they could continue in their engagement and marriage or not. So this is our core business, and it's a social entrepreneurship project, meaning it is a for-profit business, but it's also to make a social impact.
How is it doing?
It's really good. It's still surviving, still good. We're expanding. We're offering different tests now. We took it into even a more radical approach, meaning we wanted to screen families, just like the Jewish community in New York in the 80s,
right,
with the Tay-Sachs disease. What they did is they screened kids in middle school. So every kid knows what genetic defects they have even before they start dating. So we wanted to replicate this experience, and it's one of the success stories in public health. It's such a great story. They eradicated the Tay-Sachs disease in their community, the Ashkenaz community in New York, and it's been replicated in Jewish communities all around the world. So we said, oh, we could do that too. So now our goal is to screen big families who tend to have intra-family marriages due to tribal reasons and whatnot. So that's our approach now, is very like early on preventive screening, even before kids starting high school, so they could know who to pick as their partners. And given the how marriage tradition works in Saudi, it's usually your mother and your family who kind of nominates your fiancés for you. Now, if you provide them this information, they could eliminate the options based on the genetic match up, let's say.
This is high level matchmaking right here.
Yes, yeah, very high level. Yes,
and it's a wonderful sort of combination of traditional and modern, isn't it?
Oh yeah. That's absolutely. You're absolutely right. Yes.
And I guess there's been recent breakthroughs and not even further breakthroughs in gene sequencing, and so you've taken it. It was initially in Al-Asa. Have you taken it to other areas in Saudi? Is it?
Yeah. Now we serve all regions and cities and towns because we kind of simplified the process by having collection points wherever you are in Saudi. So we have a deal with one of the logistic companies who could pick your blood sample, the small blood sample, that all we need to do the DNA sequencing, whether you're in the south or in the north, and then this delivery company or logistic company pick up this blood sample and you're good. So all you have to do is hit us up in WhatsApp in a phone call, and you let us what city you're from, and then we would direct you to the nearest collection point.
Oh, wonderful. Fascinating. Yeah. So SaudiGenome.
It's such a simple and agile process. Yeah.
Which leads us to, and we come full circle sort of, but as director of behavioral insights and nudge unit, which again, I just love the name because it's just so honest.
yeah, we're nudging. Yes.
Yeah, with the Ministry of Health. Yep. And it's beautiful because it's not, we're not demanding, we're not pushing, we're like suggesting,
right,
moving you along. And Ministry of Health, Saudi Arabia, you started there full time last in 2020. Developing and implementing strategic plans to realize the unit's vision of improving society's well-being through behavioral insights. So health issues, obviously, in any country, but I think Saudi Arabia, it seems like it's going through a particular evolution, not only associated with Vision 2030 and quality of life goals, in terms of being accessed, but so much is in terms of how health information is distributed and phrased, because you have to pay attention to these things. And so in order for things to be effective, if you want to, create change and you have certain ways you want people to behave, you have to pay attention to your vocabulary and your messaging.
Absolutely.
This is where you are. This is the space you occupy right now, correct?
Correct, yes. So traditionally speaking, policymakers all around the world, they usually resort to classical economics and thinking that if you tell people the information, they would follow suit rationally.
Yeah.
And like tell them get the vaccine, they'll get the vaccine. So that's
I know. So is that case study number one, United States, the vaccine?
Yeah. Exactly.
How all the things that could go wrong.
Yeah. So we know that from like a large body of research from starting the 80s with Daniel Kahneman and Tversky, that classical economics is put to the grave because it's just absolutely not applicable to how humans think and behave. And that's when behavioral economics kind of emerged. And it just got bigger and bigger and gained more authority and trust. So that's when the UK in 2010, under the parliament with David Cameron, they started the first behavioral insight unit at the governmental level. at the prime minister level, so that they could refine their policies and programs, taking into consideration the irrationality for human beings and the end users. Because if you design for robots, good luck. I mean, like, you're not designing for any effective outcomes. You're really just wasting your money. So you really need to take into consideration the real day-to-day human being, not really this rational being that doesn't even exist. So that's in 2010 really kind of pushed behavioral science into the policy lab or the policy making. And then Barack Obama kind of followed suit when he recruited Cass Sunstein, the Nobel Prize winner, to lead the behavioral insight in the White House as well, for the same reason, to refine policies for regular citizens. Right. So that's the emergence of behavioral science into governance. In 2018, the Minister of Health, His Excellency Dr. Tawfiq Al-Rabia, innovative he is, he thought the behavioral science holds a great potential in regulating and providing health services. So he started this small unit under his office, and a year later, it was established by a consultancy firm, because there's no like really like few Saudis who have the degrees and the expertise to run it.
Because you hadn't come back from Temple, that's why.
Exactly. So right when I came back in the summer of 2020, I was lucky. I was contacted by Ministry of Health to lead this newly established unit, and that's what I do now. I guide the different programs in the Ministry of Health and give them the behavioral aspect and the behavioral elements of the services and the programs offered, because it consumes a lot of budget and money. And the Ministry of Health is one of the biggest organizations in the kingdom in expenditure. So it's really such a waste to spend all this money without taking into consideration human behaviors which are really kind of determine whether the end user use your programs or not. So here I come to advise and consult and look at things from a behavioral lens.
You know, it's interesting you mentioned the Nobel Prize, and I'm a layman, I don't know, but it seems over the last 2 decades, the majority of Nobel Prize winners in the field of economics have been behavior economics. I mean, I think it initially started with the stock market, and you know why people behave so irrationally with the stock market, and Absolutely. Then I guess it continues the same with mental health. So this was the COVID pandemic began that March 2020, and you went full-time November. What are the issues that you're dealing with since you came on as director of the Nudge unit? So
coming in the apex of COVID in November 2020, the pandemic was, of course, the issue to tackle. So I kind of advised the leadership to different aspects of kind of precautionary regulations to be placed in Saudi. So if you remember back in 2020, we didn't have vaccine, we didn't have any medicine for COVID. All you had is behavioral treatments, meaning wearing mask, social distancing, and kind of using alcohol rubs. So it's all behavioral measures. Right. And it was such a nice coincidence for me, at least in my work, to come at that time, because really the whole world was depending in behavioral scientists. Of course, pharmaceutical companies was working in Right. parallel, but as a quick response, it was a behavioral response. So I kept briefing the leadership about what we know from behavioral science that could really encourage such preventive measures, meaning wearing mask and all these things that we know. And then later, when the vaccine was available, was accessible, but was it acceptable? So this is the third element that was challenging for most governments around the world. specifically given how skepticism and conspiracy theories was really spreading around the globe. It was really interesting and very challenging to kind of sell the vaccine to people. And here comes the messaging and the framing and how you do things and how you present the vaccine became really important. So our work was around this area. So I was working with the Deputy of Awareness and Marketing within MOH in kind of refining their messages to make the vaccine more acceptable, because it was available. No question about availability or accessibility. It was an acceptance or not. So that's where we worked on loss aversion, on ego, on social norms, to really frame our marketing of the vaccine to the public. And in one of our studies, we did a randomized controlled trial, which is the best evidence in science. We randomized 6 groups, making about like 7,000 participants. We tried different framings in different people to find which message really strikes the chord and which message exactly kind of gives us the highest return of investment as far as the vaccine. And we were able to define the 2 or 3 messages that really made a difference in how people see the vaccine and then actually take it.
What were they?
So the first one was the social norm, and the frame was you are among the minority left who did not take the vaccine. Most of your families and friends did. So this is called injective social norm. We kind of inject the social norm in the text. So that gave us about a 20% increase in vaccine uptake. And then the ego framing was also interesting. The ego framing was like, it goes like this. Saudi Arabia is on top, or Saudi Arabia is the first in its response to COVID around the world. Please help us keep this national pride in top. So we kind of don't let us lose. Yeah,
don't let down the side. Yeah.
It's on your responsibility, and it's in your shoulder to keep Saudi Arabia in top of its response around the world. And given how this new era now really unifies Saudi Arabia around the national pride, we saw an opportunity to hit this chord, and it really is a national cause. So this message also led to, I think, an 18% increase in vaccine uptake. So this is kind of thing that we did in regard to COVID, but we did other things in regard to other health services and programs.
Well, one of your jobs, as in terms of understanding behavioral insights and actually influencing opinion, is understanding the population. So let me ask you, and this is kind of it's a thought question, because Saudi Arabia, indisputably was one of the top 5 nations in terms of dealing with COVID, and they did it a number of ways. We've talked about that a lot on the show. They followed the science. They had the money to make things available and accessible. They had and the community is geared a certain way. The community is very ummah oriented. It thinks about the community. It thinks less about itself and more about the community. That's maybe a broad generalization, but it's a stumbling point for us in the U.S. I mean, just quickly, where do you think we went, and where do you think we stumbled?
I think the problem with the U.S. was the politicization. How do they say it?
It's a big one, politicization.
Politicization of the pandemic. It was a political matter. I witnessed this myself because I was there in the beginning of the pandemic.
Right.
You could easily predict one's party. Political party based on their mask, whether they wear a mask or not.
True.
You had a really good shot at predicting whether this person is Republican or Democrat based on their behavior. So it was really the politics of it that went wrong, and of course, it was just a toxic political environment through which the CDC had to navigate and NIH had to navigate their guidelines and recommendations. So there was a huge gap between in the alley, as they say, and it just when you lose leadership, you lose public trust, and when you lose public trust, you lose their engagement with you and in following recommendations and guidelines. And I think that's what happened in the States.
So you're taking this expertise you have and applying to it. It's fascinating what you did with the SaudiGenome and addressing an issue in terms of marriages among closer relatives. And now we're talking about dealing with the pandemic. There are other big health issues in Saudi Arabia. And how do you rate them? For example, high blood pressure, obesity,
Right.
any number, well, I won't say any number of things. Diabetes is a big issue. Is there a moonshot for the Ministry of Health, or are you looking at a bunch of different issues?
So we work in alliance and in alignment with the strategic priorities of MOH. MOH has a strategy and has priorities. So we work in alignment with that. And speaking of diabetes, for example, I think we're going to start a new project in kind of increasing the adherence of diabetic patients to show up for their appointments, which is a behavioral issue. Again, when we talk about MOH, it's mostly a behavioral issue because you have freely accessible service. So the logical thing to do is to utilize the service if we're talking about the classical economics, but now we're talking about irrationality. So how to encourage or nudge people to utilize the services as far as blood pressure, obesity, diabetes. So our method or kind of way of working in behavioral science is that we take these big issues. This is the mantra for us. You take big issues and you break them down into specific behaviors. So you do what's called a behavioral map, in which you clearly identifies the barriers and facilitators for the end user to do X, Y, and Z that you want people to do. So, for example, if we think about diabetes, for example, you break it down and you see there's a high no-show rates for regular visits. So how do you increase adherence to health appointments, for example? And this is now, when we break it down to this level, we're talking behavioral science. However, if you're talking about infrastructure, the availability of devices, the availability of appointments, this is not a behavioral science issue.
Right.
So my unit is really has a niche and a very specific role in breaking down big health issues into behavioral elements, and try to pick one of these elements, the most impactful elements, and try to address that.
But you do, and that's fascinating, and that makes perfect sense. You do sort of have to understand your tools, and I say that because you said right at the beginning, one of the terrific advantages, if you're a Saudi citizen, you have free healthcare. So starting with that, that barrier is not there, and that's why you were talking about the psychological. Why aren't people showing up for their appointments when it's when it's covered? The other thing is communication. Do you use in which Saudi Arabia has shown remarkable skill, like Abshur and Tawakkalna, these apps that can be used to change and promote certain sorts of behaviors?
Absolutely, yeah. So it wasn't long ago when what is it called? There was a decree from, I think, a royal decree about organ transplantation after death. So just like the rest of the world, there's the shortage of organs, and there's just too many people waiting in line to get transplantation.
Right.
So this new kind of royal decree encouraged organ transplantation. So this service, to sign up for this service, was added to the Tawakkalna app, which is a universal app everyone in Saudi who's 18 and above has to have right now. So we wanted to utilize this platform to nudge people to sign up to be an organ donor, a deceased organ donor. It's a complex decision to make.
Right.
It's very different than when you're living, because when you're living, there's no other kind of complexity in the decision making. But when you're deceased, like it's your family's decision, it's not your
Right.
decision.
Right.
You have these sacred beliefs that your body does not belong to you, it belongs to God. So it's not your job to make a decision about your body. So we wanted to utilize this platform. So we had an agreement with the administrator of Tawakkalna app to redesign the UX experience and the messaging and the wording and the process to facilitate and nudge people to sign up as an organ donor.
Right.
So this speaks to your comments about using the platforms. It's been such a great enabler because many of the services actually could be utilized through the apps. So UX or user experience is such a big component in it. So that's when like you get behavioral science to kind of optimize the whole interface to get you the desired outcome.
Well, that's not a medical thing, but that whole behavioral transformation of using these apps and your phone and smartphone and using e-government services, which are now widespread and seem to be pretty successful. That's a huge behavioral shift that's happened in Saudi Arabia in the last 3 years, 2 years.
There's a transformation, revolution.
Extraordinary.
There's so many other places to go. I guess if I could ask you, what do you miss about living in the U.S.? Because you were here for 15 years. Now you're back home. What do you miss most?
The trees.
The trees.
Yes, the public parks. I used to just stroll around, like it's next door to me. It's always next door because there's ubiquity of it. So I really miss that. I mean, we got lucky with the oil here as far as geography, but not really with the weather and the sand and the whole thing. But I think now to kind of improve this, I don't know if you guys heard about the Green Riyadh.
Absolutely.
Yeah, you heard about this, guys? Okay. Yeah.
No, give yourself another 15 years and hopefully there'll be 10 billion trees. And
10 billion trees,
yes,
I think it is.
Yeah. And you already start seeing some of these. If you see some Google images, you see the transformation already is happening. So really stoked and interest, like really excited to live in a greener Riyadh. And I think this is happening around the corner, hopefully.
Yeah, fascinating. The transformation is ongoing. Mohammed, what a thank you so much.
I appreciate this.
Just a terrific. Thank you for sharing your journey from the 17-and-a-half-year-old kid, going off to the U.S. and then coming back. It's just been fascinating.
Yeah. I'm really thankful for the opportunity, and I feel so appreciative and so much gratitude to this country who provided this unbelievable opportunity. I mean, people were hating on us in the States when we were telling them that our tuition is paid and we get stipends and we get healthcare. And like you guys had to be like working in waitress and whatnot for like 17 hours a day or something. Yeah. So people were jealous, and really that I did not take it, and I still do not take it for granted. I really feel the gratitude and just being thankful. Just really thank you. Yeah.
Well, thank you, Dr. Mohammed, for joining us on the 966. This was a great discussion. We hope to visit you soon in Saudi Arabia, and hopefully some of the tree plantings have taken place by then. We can walk around the new parks in Riyadh.
Absolutely.
Thank you, Mohammed.
You all.
Wonderful.
Thank you.